In the late 90s, it became clear that the city of Birmingham needed a new purpose-built healthcare facility to serve the growing needs of its population. The teams at the Queen Elizabeth and Selly Oak hospitals had a clear vision for the future. On the 16th of June 2010, Birmingham's first new acute hospital in 70 years opened its doors, ahead of time and on budget. The Queen Elizabeth Hospital Birmingham, named after the Queen Mother, cost £545 million and is the largest single-site hospital in the UK, providing a world-class environment in which to deliver world-class care to the 800,000 patients it treats each year. QEHB is a major trauma centre, taking the most critically injured patients from across the region, many of whom arrive at the hospital by air ambulance. Some 94,000 patients are treated in A&E each year or are seen in the 72-bedded clinical decision unit, where they are assessed and undergo initial investigations to decide whether they need to be admitted to hospital. QEHB underwent the NHS's largest purchase of cutting-edge imaging equipment, spending some £22 million on the most sophisticated scanning and X-ray machines available. The department covers an area equivalent to 9 tennis courts, carrying out over 270,000 images per year. No one wants to stay in hospital longer than is absolutely necessary, and one of the key drivers when designing the new hospital was to decrease the length of stay for patients pre- and post-surgery and to increase the number of patients having procedures completed and discharged home within 23 hours of admission. Ambulatory Care treats over 37,000 patients a year. As a major trauma centre and the hospital that treats all injured military personnel returning from combat, access to theatres is essential, and QEHB has 23 of them in its main suite, performing 500,000 hours of surgery each year, undertaking nearly 32,000 procedures. After undergoing an operation in theatres, those patients who have had complex surgery will be returned to the critical care or burns unit to recover from their procedure. QEHB has 100 critical care beds, which makes it the largest unit in Europe treating the sickest patients. There are 29 wards in the QEHB, the majority of which have 36 beds, and 44% of those are single rooms, with the rest being 4-bedded rooms, all with en-suite bathroom facilities. QEHB is very proud to host the Royal Centre for Defence Medicine, and not only trains hundreds of nurses and doctors within the organisation, but treats all the injured military personnel that are injured in combat and non-combat activities. Over the last 10 years, QEHB has cared for 17,500 military inpatients and 61,500 outpatients, with hundreds of patients surviving previously fatal injuries as a result of the unique partnership between the nurses, doctors and support staff from RCDM and QEHB. The road to recovery for military patients, many of whom have lost at least 2 limbs, starts as early as possible in therapies at the QEHB, with patients being put through their paces just weeks after arriving on a plane from Afghanistan using equipment funded by QEHB charity. The chaplaincy team visit patients and relatives on the ward, or alternatively staff, patients and visitors can go to the Faith and Community Centre to pray or seek some sanctuary. In a great example of public and private sector partnership, Balfour Beatty and QEHB charity have paid for the building and kitting out of the centre at a cost of more than £1 million.